Welcome to the Hub Dental Practice.
The truth is, nobody likes going to the dentist, but if you have to, you should go to a good one. And I think the Hub really is very good.
My name is Marcus and I'm a dentist. I run some of the busiest practices in the country. It all started here in Milton Keynes, but today we have practices in Cambridge, Peterborough, High Wycombe and Northampton. I now work as part of the group my mum and dad set up so many years ago here in Milton Keynes. This is a proper family business.
I've been a dentist for almost 40 years, and the one thing I realise is that you've got to meet the patient's needs, their expectations and their lifestyle. People do not want to wait. They want to be treated fairly, professionally and properly. We have a very large team of dentists here. Dentists, hygienists, therapists, dental nurses and receptionists.
My name is Dr. David Narte and I am a general dentist here at the Hub. I have a special interest regarding implants, dentures and crowns and bridges. I had my degree in Hungary, so I graduated there, and after that courses regarding implants and restorative dentistry. If patients has missing teeth, then they found the right person to talk to, because I am the one who is helping to replace the gaps. We can do this with dentures, bridges or crowns and implants. So implant basically a artificial tooth placed in your jawbone, and it can hold the crown and it can help you to have a good chewing ability after the treatment is done.
Our patients know that they can rely on us. We offer state-of-the-art care 7 days a week, and we answer the phones 24/7. So no matter the problem a patient has, we will be there to help them.
These are patients who go to other dental practices but come to see us when their dentists are shut or their dentists are on holiday or just simply not available.
Because I had a bit of a problem that could be resolved by my other dentist, I phoned their 24-hour emergency hotline, and it was around 10 o'clock on a Friday night. And they dealt with it. They were very professional, they were there, they were open. And of course, when I found the place, I just thought, well, you know, yep, this is where I need to be coming.
My name is Khawla and I'm a qualified dental nurse and the practice manager. Patient's care comes priority on the top to make sure that everything is run smoothly for good quality of care, and obviously a same priority for looking after our staff and making sure that they are learning new skills and also implementing them to help our patients. We offer a finance option through a company called Tabio, and we do also offer interest-free for up to 12 months.
The fact that you can have a second opinion in-house is really, really important to patients.
I've been coming here for 8 years now, and initially David was my dentist, but I've also worked with some of the other dentists in here because I've had a couple of other problems. So this dentist is very good because they have dentists who've got specialist interests, which means that when another problem was found, I was referred to someone who dealt with that, which suited me fine.
My name is Giovanni and I'm a dentist that treats periodontal problems, which basically is gum problems. I graduated in Italy, and then basically all the postgraduate and master degrees have been still in Italy, in Florence and in Rome. Then I moved to the UK, and it was supposed to be something just for a year, and I'm here after 10 years, still in the same practice. Most patients that come to see me are referred basically by other dentists, so I actually need to be grateful to my colleagues and to the team, and it's one of the special part about working in this team that they trust me enough to treat their patients, and once I finish with my job, they return only to the regular dentists.
We design all of our practices to make sure that they're friendly and welcoming, because we know how important that is to our patients.
The first thing I ask myself is this sort of person I want to have greeting patients and treating patients? Is this the sort of person that patients are going to warm to?
I think this is such a great practice. The range of treatments is phenomenal, and there's always time to have a chat. So I like that. You get a feeling of sort of like warmth. Yeah, warmth.
I think that almost every patient is anxious when they come to the dentist. I think even dentists themselves, when they go to the dentist, are anxious. And I think that's a perfectly normal and natural thing.
I've been coming here, since I was born. I've always been, when I've come here, felt at ease. They've always made me feel relaxed, always explained everything, and they're all really friendly people.
We offer sedation in the practice. We work with a sedationist. That's an outpatient procedure, so involves giving some medication in which changes their state of mind. And the good part of sedation, most of the patients do not tend to remember the procedure. They just need to bring someone in here because we cannot send them out. They're going to be able to walk on their own, but feeling a little drowsy, a little confused, but should be okay.
You just let us know if you want to have any treatment with sedation. It's very easy process to get it booked in. We can just contact the sedationist and arrange the appointments, and that should be it.
Orthodontics is a speciality in dentistry that focuses on correcting the position of teeth. For example, if you have gaps, we can close the gaps. It means if you have a very deep bite or a really big overbite, we can correct that. And also we can straighten the teeth. So a big concern for a lot of patients is that their teeth are overlapping, especially front teeth. So what we can do is we can offer good solutions for straightening them out. And also orthodontics works really, really well with cosmetic dentistry. So sometimes it's really good to straighten out the teeth, put them in the ideal position, and then place crowns or bridges. That way they look the best and the treatment has the best outcome. Instead of traditional brackets, braces, it's a series of clear retainers. Invisalign works by changing the retainers every 1 to 2 weeks that help the teeth move. You can really see week by week how the teeth move. Typically the process is quite quick, so it can be finished in as little as 4 months. The average is between 6 months and a year.
I am Gulil Al-Azhar. I'm basically a restorative dentist with a special interest in cosmetic dentistry, and I do same-day crowns, which means we do CEREC restorations here. This machine on my right is what I'm talking about. So it's a same-day crowns made out of porcelain. So patient walks in, which happens quite often with us. We are emergency dentists. Patient walks in covering their mouth with a hand because they had a trauma, front teeth broken. They walk out with a smile because we've provided them with a crown, a porcelain crown, same day.
My name is Bilal. I am a general dentist that focuses on emergencies and aesthetic dentistry. It's 7 days a week. An emergency can just come up anytime, and I get to see people and hopefully fix their problems on the day. And then I actually focus on aesthetics. You went for a jog, you've damaged your front tooth, we can make it look normal again. Or even if you just want to refresh your smile, brighten your smile, we do whitening, Invisalign, veneers. So the focusing is just on making things look nice and actually making you feel nice.
My name is Lorenzo. I'm a Spanish dentist. I moved to the UK 8 years ago. My practice is limited to endodontics and restorative dentistry, and my goal is to save and restore damaged teeth, always trying to obtain the best long-term results. I hold a master's degree in endodontics and restorative dentistry from the University of Valencia. I keep updated annually with lectures and courses to provide top quality care. I enjoy working at the Hub because we have a very talented team, a great atmosphere, and the latest technology. And this allows us to deliver very high quality treatments.
My name's Jazz. I'm one of the general dentists here at the Hub, and I've got advanced training in periodontics and oral surgery. So periodontal disease, also more commonly known as gum disease, is an inflammatory condition of the gums, which can have serious consequences if left untreated. My job is to diagnose and make sure that it's identified early as possible to provide specialised care and to prevent tooth loss. I like working at the Hub because of my colleagues. We're all friends here, and it allows me to collaborate with an extensively trained team who I can rely on 7 days a week. I don't have any hesitations in asking for their opinions and working with them closely to bring about the best patient care.
My name is Simla. I'm the hygienist here working at the Hub Dental Practice, and my focus is to keep your teeth and your gums healthy by preventative oral care. I'm also able to apply fluoride treatments and sort of plastic coatings on the chewing sides of the teeth, so these are fissure sealants. I also teach you how to maintain your good oral hygiene. I completed my bachelor's degree in dental hygiene and therapy, and so I went to Glasgow Caledonian University for 3 years. You're put in a mix of sort of classroom teaching and hands-on training, and then throughout those 3 years you take loads of examinations, and then towards the end of it you're a competent clinician able to carry out safe and effective dental care. I would describe myself as being a very dedicated dental hygienist. So, and what I mean by that is I will always make sure that we're doing everything we possibly can to make sure that your oral hygiene is in tip-top condition. And I tend to go through these sort of tips and tricks of how to maintain your good oral hygiene through toothbrushing, what toothpaste you should use, what TPs you should use. These are the things that you use to clean in between your teeth. And we'll make sure to work really well as a team together. I tend to create a nice sort of atmosphere for my patients, making sure that they're really comfortable. I'll be as gentle as I possibly can and make sure they have a good, comfortable experience. I have a tattoo, it's a tooth, it's some dental instruments and a little extractor just there. So I had it done at the end of dental school as soon as I graduated. Me and my best friend, we've got matching tattoos, and it's nice for all my patients to see whenever they notice it, that is, and they know how dedicated I am to their oral hygiene.
Cross-infection control is of paramount importance to the success and safety of every dental practice. It's not just about protecting the patient, it's actually about protecting the dentists themselves and also the whole clinical team. And actually, a practice that practices the highest levels of infection control is the sort of place where I personally would like to receive my treatment, and where I would like my family to receive their treatment.
One of my jobs running the practice is of course to make patients happy and to make sure we're offering gold standard treatment, but it's also to attract the best dentists, and the best dentists want to work in state-of-the-art practices, in practices like ours.